Good morning and welcome to my video vlog today. It's the 31st, so last day of the month in July. We go into August, and yeah, interesting news last night from the government in terms of this, well, not really a lockdown, just some cautionary measures being taken in parts of Lancashire and West Yorkshire to establish, well, to ensure that the virus doesn't spread. Basically, it only was announced about 10 o'clock last night. Well, that's when I heard it anyway. And it was basically that we, in those areas, have now got to actually, well, they can't share, they've got to stay within their own family groups indoors. They can't go to other people's houses, even other members of family. So there's been a bit of a restriction put on that movement. They can still go to restaurants or pubs under the new guideline conditions and do their shopping and stuff like that. So they're not strictly locked down as such, but there are restrictions effective from last night. A lot of people were again up in arms, and the government have made it clear that their interests are in the public health, and people must just listen to the rules carefully. But a move like that automatically spikes debate, and people start asking questions like, do the government know what they're doing? Why weren't we given more notice? Silly questions really, because when you're in a pandemic and things are happening live around us, the government's got to act straight away, hasn't it, really? And it really comes down to that. And as I've said before, the government are in the wrong regardless of whatever action they take. It becomes a bit of an issue. It is worrying that it's not just in the UK. In fact, more so in places like Spain, which are seeing vast increases, huge increases in infection rates, going back up again now. France as well, Luxembourg as well, Belgium as well. Even Germany is having sort of a slight increase in their infections. So we're in the summer as well. I said, we're going to see a resurgence of this infection rate going up in the winter months. I've got to be honest, I wasn't anticipating we were going to see infection rates creeping up so quickly while we're still in summer. Now that tells me really one thing very clearly: the restrictions that have been removed by not just the UK. I'm talking more across Europe as well. Opening up public places and opening up restaurants and shopping, etc., etc., has definitely brought the virus back. It's brought it back, and it may only be in isolated areas throughout various countries at the moment, but it's clearly coming back. I think it's something we're going to have to read very carefully in the next few weeks, and if it really starts coming back with a surge, I can't see anything other than a lockdown again, personally, because it's going to. Yeah, even the Baltic states. I was getting a report that who have been relatively low, and suddenly they've started having major infection rates. And a concern there is their hospitals are already overrun with patients, that require more critical care. They're being overrun. So, says to me, there's an issue. We also had a report come out yesterday that England have the highest death rate across Europe, which I think we already knew that. Actually, yeah, England was sort of top of the list, and the UK as a whole were sort of second on the list, and then it was other countries like Spain and Italy, etc. But yeah, we already, I think we gathered that based on the daily figures we're already sort of reading from the World Health Organization that had you obviously got the figures from us anyway. I think there is still some dispute about the figures in terms of what we're measuring as a COVID death compared with certain other countries. But nevertheless, we know our figures are not good. They are not good. And of those deaths, a large proportion of them have come out of care homes. Not all of them, but a large proportion have been in care homes. We also know that people who are in their sort of latter years are being infected more, are having more of an impact, with the virus in terms of death rates, and also people who are non-white in respect of their colour, ethnic background seem to be affected as well. Now that's obviously got to do with, I don't know, possibly the way they live in larger communities within their homes, possibly, or other cultural facts that go into making the disease easier to transmit. I mean, it has to do with things like that, I would think. And also, I'm advised that a large proportion of that group in society suffer with diabetes, so yeah, that could have an impact as well. We'll have to watch very carefully and see exactly where we go with this. Moving off the UK and Europe, I see also the figures in South Africa, COVID figures, are just getting from bad to worse. I mean, infection rates there are significantly higher now. I mean, they're up into the sort of tens of thousands per day now that seem to be picking up on the infection, and death rates there are starting to creep up as well. Death rates now for the last few days have been higher in South Africa than in the UK, which is a worry because obviously UK's been trending high anyway, and South Africa were quite low, but now South Africa's death rate is creeping up, the daily death rate I'm talking about. So that's a concern. It means that practice there has not worked. They also, I think, is also in a semi coming out of lockdown as well. So I think it's, again, a major concern. The country doesn't need that. It's got enough on its plate already. It's the last thing it really needs to get severely impacted with the COVID-19, making everybody ill, overrunning hospitals, and really bringing the country to its final death. I mean, that's what's going to happen if it gets out of hand in South Africa. We don't get many. I mean, I've got reports on other countries, Botswana, Zimbabwe, Ghana, Kenya, Mozambique, Sierra Leone, all quite low, which says to me people are, obviously people don't travel there. There's still a lot of travel, obviously, happening in South Africa. There's still a lot of people that travel into South Africa from other parts of the world. There must be, otherwise the infection rates wouldn't be as high as they are. So there is obviously a process of movement that goes on in South Africa that's causing these major infection outbreaks to happen at the level they're happening. It's there, it's got to be. Whether they're coming in through other Africa, but now the seeds are in there, of course. Once you've seeded the infection to a fairly high degree, and you're not taking good measure against it, because you've now got sufficient infection in the country, it's seeded. If you're not controlling it, it can double every 2 to 3 days. I mean, that's basically what can happen, and that's what you can see happening in South Africa. So it's obviously seeded in the country now, and it's now starting to take off because controls are not significant in there to actually hold it in certain areas. I mean, I'm beginning to see that. I can understand it. In our country, our problem, I think we're having, is with younger generations. The younger generations, it's been a 4-month period of this thing still hanging around, and I think a lot of youngsters thought this was going to be over within a few months, and they've laxed their guards to a large extent. I've noted it, in town. I've noted it walking around generally. I've noted it when I'm speaking to youngsters, and they, I think, have been thinking, well, things are getting back to normal, things are okay, life goes on, la 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 la. But no, I can see them gathering in groups in the parks. I can see them gathering in groups, in just social gatherings. They're not being, anything else. They're not being disrespectful or anything like that, but they are just gathering, and that is causing the spread in our case at the moment. I can see that being. It's not a load of old people going out and mixing and, middle-aged people doing it. It's the youngsters which are causing these spikes. And I think that's what they were saying in Spain as well. This exactly the same. So our information is that South Africa have got to establish very quickly how these infection rates are expanding. What's the cause? I mean, are they happening more in the townships and poorer locations? Are they happening in particular regions of the country? Is there more happening in Cape Town than there is in Johannesburg or Durban or wherever? Where are, they've got to isolate and find out what's going on in those locations and get a grips with them and prevent further seeds developing throughout the country and get it sorted out. Now, perhaps they are doing that. I don't know. I mean, I don't get all the South African news, but it just strikes me. And I know it's winter there, of course. I mean, we're big southern hemisphere. They're in the winter months, but the winter they're still relatively outdoor in society, living and everything else. So very worrying. A country that does seem to be controlling its virus well, if anyone can be accused of handling it well, is Poland. Let me just look up their numbers here. Poland is another country. I haven't spoken much about Poland in recent weeks or months, and it's not that it's off my radar. I do look at their things as well, because I have a lot of friends in Poland as well. But they haven't anything really of significance that I can see. They were very close to the Philippines at one stage, and Philippines is now ranked 20th in the world. So far they've got 90,000 infections, and they've got nearly 2,000 deaths. They were very close to Poland, so they're 90,000. What's Poland now? Poland is way down. Poland is in 46th position in the group. It's only got 45,000 infections. It's got 1,700 deaths. It's for a country of that size in Europe, it's maintained disciplines in the country, obviously, and the virus isn't spreading at any alarming rate like it is in the Balkans at the moment. No, look, touch wood. I don't want it to change, obviously, but that's an encouraging sign. The Philippines is slow. It's not growing as fast as South Africa, but it is also going up. They've got 100 million people, and I think they've got a very strong discipline when it comes to managing these type of viruses, as all countries do in Southeast Asia. But their virus is much more apparent than, shall we say, in Thailand or Malaysia or South Korea. There seems to be more movement. The death rate is still under 2,000, but they are getting more infections. Their infection rate is up to over 2,000 infections, but they're recovering. You know, the people are getting the disease and are recovering from the disease quite quickly. So they're not passing away, unlike what happens in Europe and America. You know, the percentage of people who get the disease in the Philippines seem to recover from the disease, which is good. And I mean, that's what we want to get it to in Europe. I mean, I think to cure it is you know, we've got these vaccines that are coming close to fruition. This was one that Oxford have been developing that looks like it could be available for what could be announced as being available for production in September, and then we'll see how long it takes to get it into people. But the thing is, we want to have medication of sorts, even if we can't, you know, beat the virus or make ourselves immune to the virus. At least if we can treat the virus in some way that reduces the, you know, the mortality rate, it brings it into a manageable sort of equation where people get the virus, they get sick, yes, but they recover due to treatments and can still, you know, survive. We're not in a situation where the odds are at a certain age, if you get the virus, you're not going to make it because you haven't got the body to handle it. I mean, that's what we're trying to get to at the moment. Recovery rate on that says to me that people in the Philippines, diet-wise, health-wise, and all those things, all those good things that we talk about, you know, on this channel, are working over there. You know, people, there aren't obese people. Well, there are very few obese people in the Philippines. There's no starving people, well, very, very few starving people, but people have healthier diets. They eat a broader range of vegetables. They eat a lot of healthy food that you know, gives their body the zest. And you do see it. You see it around you all the time. You see people in their 80s zapping up coconut trees and things like that. I mean, really amazing stuff, really. And they're very agile in their 80s. I mean, we do have them here, but they're not the norm. You know, most people in their 40s couldn't zap up a coconut tree. Never mind about people in their 80s. Yeah, that's gonna be something we should probably try. I'm not suggesting, you know, everyone should go out there now, find a coconut tree and start zapping it, trying to zap up it. No. By the way, has anybody come across the noni? It's in the health stores. It is selling. I just wondered how anybody finding it hard to get these at all at the moment. If they are, let me know. You know, or if you know anybody who's looking for something like this, let me know so I can see what I can do to help them. Okay. No blog going out today. Mummy's given me instructions. She went off to work at 6 o'clock. It's now 7:30 in the morning. She went off to work early and left me with jobs. So I'm going to get on with my jobs now. Talk to you again soon. Bye-bye.